Hello and welcome to this UniTaster OnDemand event today. My name is John Cheek. I'm the founder of UniTasterDays, and it's my job to introduce the event and introduce our speaker. The speaker today is Dr. Gail Nicholls, who is the head of admissions at the School of Medicine with the University of Leeds. And Gail is going to provide an overview to studying medicine at university. So she's going to talk about things like what to expect if you study medicine, why you might want to consider medicine, application tips to include things like the tests you might well run into, interviews and more, and also some of the career routes that you might also be subject to as well following a medicine course. But with that, I'm always aware that you've tuned in to hear from our speaker, not from myself. So let me pass things over to Dr. Gail Nicholls, joining us from the University of Leeds. Over to you, Gail.
Thank you very much for that introduction, John. Yes, my name is Gail Nicholls. I'm head of admissions at the School of Medicine at the University of Leeds. My background is as a general practitioner, and I have been teaching on the undergraduate and postgraduate programs at Leeds for 14 years, and during that time have been involved in admissions. I'm going to have a short talk with you today covering what you should be considering, thinking about if you're considering a career in medicine, what to expect if you study medicine as an undergraduate degree, advice on how to get into medical school, and what will happen after you graduate. So why choose a career in medicine? Medicine is a hugely rewarding career. It's a fascinating field of study which offers the ability to apply science to real life situations. As a caring profession, no matter what specialty you choose, you'll be part of an interdisciplinary team delivering excellent patient care. Doctors do hold positions of leadership and responsibility and are highly trusted by their patients. And with that trust comes responsibilities. Doctors' roles are intellectually stimulating, practically challenging, and hugely rewarding. It is essentially a hard career to follow, and it isn't for everybody. So you need to consider whether or not you're up to those challenges, but it is hugely rewarding and you will get so much back from being a healthcare professional. There's a considerable variety within medicine, and people forget that there's choice. There are choices about whether to work in hospitals or in community-based medicine. And once you have been through the full-time undergraduate study, there are the options to work flexibly and part-time and to have what's called a portfolio career, where you might be, for instance, a general practitioner, but you might have a special interest in gastroenterology. So looking at the gut and dealing with gut health. So there are plenty of opportunities for you. If you entered the career, you will be entering a huge community of doctors. And this is a slide that is taken from the General Medical Council, showing how many doctors are registered on the NHS across the devolved nations. But doctors are just one of those roles in that healthcare professional team. And so, in fact, there are about 1.5 million people employed by the NHS, and you would be part of that community. So what should you expect if you study medicine? The content is obviously based around a career in the NHS. And all of the curricula across the UK, across the different medical schools, are set for the outcomes for a graduate entering the NHS. It is something that is a very rich learning environment, and is the contribution to that rich learning environment is a mixture of scientific researchers who are teaching you about cutting edge medicine and research, clinical teams from across community and hospital medicine, and very importantly, people like patients and carers who will speak to you about what it's like to be at the centre of this NHS care. Throughout your studies, the type of study varies year on year. So in the early years, you're learning a lot about the scientific side, so be it anatomy or physiology, how the body normally works and what happens to it in the disease process, so pathology. Many of the courses now have early year placements from the outset of the course. You will learn in a safe environment how to take a history and examine a patient, and that patient contact time and the amount of time you spend in clinical environments in hospital or general practice increases year on year, so that by the time you come to the end of your studies, you are mainly off campus, so out of the university environment, you're embedded in patient care, and you will be shadowing the doctors that you will be the doctor of the following year. There's increasing use of IT within the curriculum, so that gives you ready access to the knowledge that you need. And also we use IT very much within work-based assessment. So assessment examinations happen throughout the course, but are also there ready on placement, where you'll be getting immediate feedback on how you're getting on and the next steps you need to do in your learning. So in the next section, I'm going to be telling you about how to apply to medicine, and it can seem really daunting. A lot of social media sites will tell you the competition ratios, but the key to success here is having a good understanding of what hurdles you need to get over and what sources of information and support there are out there for you. So across the medical schools, we all have the same tools in our arsenal to select the best healthcare professionals of tomorrow. We have your academic record, which we obtain from the UCAS form. We all use some form of admissions test on top of that academic record. And then we carried out assessment of those non-academic values through personal statement and references, and then subsequently interviews. The main shortlisting processes across the UK are based on the academic record and these aptitude tests, and the use of personal statements really has gone out of favour in recent years because it's the least valuable tool we have in our arsenal. But it's a good preparation stage about thinking about those components, those key skills and attributes that you're developing throughout your life that we want to look at to again look at in depth at interview. When you're considering about where to apply, it's important to remember the range of courses that are available to you and to have a really good understanding of what they are looking for. Those tools that were in the previous slide, we use in different weightings and in different ways, and that is dependent on the ethos that we have for each of our courses. So every year, all the admissions deans or admissions tutors, if you want to call them, throughout the country, make sure that our entry requirements are clearly available and transparent to all our applicants. Those can be found collectively on the Medical Schools Council website on their entry requirements booklet. And there are further sources of information that then you can go to through looking at those individual medical school websites. So make sure that it's a course that you like the sound of. Make sure that your profile as an applicant, be it GCSE or equivalents or A-levels, is meeting the entry requirements, and that they have an admissions test that you feel that you'd be capable of doing. That choice is really important, and along with that choice there will be additional information for you, including competition ratios and what the format of their interview process might be. Aptitude tests are these admissions tests that we're talking about, and they can seem to be just something that is of a huge anxiety for our applicant pool. Yet again, the key is to understanding what they're looking for and what you will be expected to do. And there's a huge amount of information on the individual websites for you. So please visit the website, have a good understanding of the deadline for each of those admissions tests, and use their practice papers. Final thing I want to say in this section is that finances should really be no barrier to application to medicine. And all of the admissions tests have some form of widening participation bursary to refund the fees that are associated with each of these tests. I really feel that this is one of the most important slides in this slide pack because it demonstrates what makes a good doctor. This word cloud was created by the General Medical Council when it updated its guidance, Good Medical Practice, back in 2011. And what it did was it asked patients, lay people, clinicians, what makes a good doctor? And it's our job as admissions tutors to select for these attributes, these non-academic skills. One of the things you'll notice in this cloud is it's actually really difficult to find knowledge, and people really worry that they have to be very knowledgeable as a doctor. Yes, you do have to be knowledgeable, but the things that are important to patients are about communication, about listening, about understanding, about treating people with respect and dignity. And it is those attributes that we will be looking for on selection into medical school. All of those attributes feed into the values of the NHS and the NHS Constitution. And it is about working together, being a team player, improving people's lives with compassion. Further information again on the roles and attributes that we're looking for can be found on the Medical Schools Council website. So what do we want to see at interview? We need to know that you can communicate clearly. You can see from the word cloud how important that is. We want to know that you've looked into the career. You have that motivation to be a doctor. And we need to understand that you can reflect on past experiences about those attributes that we are looking for. You will be given a variety of what we call stations, which are individual interview questions. And most medical schools now use what's called a multiple mini interview, when you'll be interviewed by one or two people at a time and rotate through these number of stations. The list here is an overview of the stations that are used nationally, but again, further information will be provided for you during that applicant journey or can be found on the websites that I've already referred to. Every time we have contact with you on this applicant journey, we know that's just a snapshot in time. Please use our contact details that can be found on all our websites to ask questions as they come up along that applicant journey. Please keep on referring back to the sources of information on the Medical Schools Council website and the Studying Healthcare website. These are key sources of reliable information and are free, and they link through to other things that you might want to work through, including modules of learning that can help you understand better what we're looking for. So now I'm looking forward into the future, thinking about the fact that you've been successful on that applicant journey, you've come to medical school and you've got through to the point of graduation. Undergraduate medicine is just one step in that lifelong journey of learning, and I've never stopped learning throughout my career. You're obviously will go through set profiles at different stages and set types of learning. So once you graduate, all graduates in the UK apply to different foundation schools around the country, where you will do 2 years as a foundation doctor, a junior doctor. At this point, you will start earning, which is, of course, a huge benefit for everybody, but you will be continuing to carry on your learning before choosing your specialty career. The duration of that career and that training pathway will depend on whether or not you take it part-time or full-time and which hospital or general practice specialty you go into. And this diagram gives an outline of the anticipated years of study. I want to finish by saying that it's all about choice. And the most important thing is that you think really clearly about this lifelong journey that you want to enter into. The NHS Careers website has lots of video clips and some reflective pieces for you to think about whether or not that career is right for you. And it has an excellent quiz tool that you can take that can help hone those ideas about which individual career areas might be right for you. Also, it's really important to think about your plan B. You can apply to 4 medical schools, but you can have a 5th choice. And that 5th choice is something that you could consider as an undergraduate career before going into medicine, perhaps in the future as a graduate. But I just want to wish you good luck and just to remind you that we're all here to support you. So please contact us and use that support.